is the restraints considered ethical inside of the school system? And inside of my group today will be Cameron Jones, who will present and be arguing that chemical restraints are ethical. Carrie Carroll, who will argue that is unethical, as well as mechanical restraints are ethical. We also have John Fuqua, who will be arguing that physical restraints are ethical, and Lana Snap, who will argue that physical restraints are unethical. Also, myself will be serving as the moderator, and I will be doing the intro, and I will also argue that mechanical restraints are unethical as well. So first, we will start with Cameron Jones, who will argue the ethical part of chemical restraints.
A chemical restraint is when medications are used to control a person's behavior or to restrict their freedom of movement. They're ethical for children who can become agitated and become a danger to themselves as well as other individuals. When this occurs in schools, they can also disrupt their learning environment as well as other children's. Benzodiazepines are a group of medications that are typically used as a sedative, hypnotic, anxiolytic, anticonvulsant, and muscle relaxant. Examples of these medications would be Xanax, Valium, Versed. Those have been proven successful to decrease agitation, and they have less side effects, and they can actually be reversed using a benzodiazepine antagonist, flumezine, which is used after a procedure to wake someone up who's been under an anesthetic. There are situations that arise when individuals are actually causing immediate harm to themselves and others. So there was a guide created for medical personnel to follow in order to be able to administer the medications appropriately. The Council for Children with Behavioral Disorders state that if a child requires a medication during school hours, that the physician provide a written protocol, and that must be approved by the parents. There was a study conducted in a hospital where they examined patient records and determined that the use of chemical restraints on aggressive patients was helpful to calm them down. Ketamine is an anesthetic medication that is most commonly used when patients are put to sleep for surgeries or some procedures, and they also prevent pain during those surgeries or procedures. The patients in the study, they were being transported to the hospital, and on the way there they were given the ketamine, and then once they arrived at the hospital they no longer needed any other emergency care. So because of this, because these medications were proven to be successful to calm the individuals, the use of chemical restraints is ethical.
Hi, I'm Carrie, and I'm going to do the rebuttal for the chemical restraints used in hospitals. Even though ketamine is mostly commonly used type of medication to put patients to sleep and prevent pain from occurring during surgeries, it is also known to have adverse side effects such as hypoxia, where the body is deprived of adequate oxygen supply. Another study conducted within the hospital setting found 3 alternatives that were successful in calming patients who had become agitated. The first alternative involved nurses at the hospital simply interacting with their patients more on a daily basis, producing an environment that helps patients feel safe and secure. The second alternative is a multi-professional agreement where a hospital staff member sits down with the patient one-on-one to discuss his or her care, answering any questions she may have or he may have, and discuss options for alternative treatments the patient may be eligible to receive. In some cases, the hospital staff member may even share their opinion on what treatments may be most beneficial for the patient. Lastly, some doctors and male nurses use their authoritative figure to calm patients and prevent any negative behaviors from taking control. Because alternative treatments have shown to be effective on agitated patients, the use of chemical restraints are an unnecessary aversive procedure. In rebuttal to the use of benzodiazepine as chemical restraints used in schools, there are other types of medications used as well that can be bought over the counter, such as antihistamines. Antihistamines primarily used for treating allergy or cold symptoms are being used by parents to decrease agitation in their child while in an educational setting, within the hopes of increasing their ability to stay on task longer. This is most likely due to the fact that parents are already familiar with the use of antihistamines when treating their child at home for allergies and/or cold symptoms. The problem is that medications are not always being administered correctly or used for their intended purpose, and as a result could potentially be more harmful to the student, violating the core ethical principle, do no harm. If over-medicated, students may experience drowsiness, anxiety, vomiting, constipation, diarrhea, headaches, and loss of appetite. An example of how parents may violate the core ethical principle of do no harm and school policy regarding the administration of over-the-counter medications recommended by their doctor is to provide supplements in their child's lunch pail, making the child or his or her aide responsible for administering the supplements throughout the day. This could potentially pose a serious health risk to the child if the dosage is administered incorrectly, essentially causing more harm than good. To ensure that the proper dosage be given, it is school policy that all medications, including over-the-counter medications and supplements, be labeled and administered through the school nurse or any other office staff member.
Okay, and real quick, you guys, Dr. Derringer wanted us to answer the question. Cameron, maybe you can do this. Why would we use a chemical restraint over other restraints? I'm sorry, Cameron, I'm trying to unmute you. Okay.
Okay. Well, as Carrie was saying, they do use antihistamines sometimes. So for children, a lot of times that's what's mostly used, and because you can get it over the counter, and a lot of times parents know more about that medication, they feel more comfortable giving it, as well as other supplements. And sometimes, they are even recommended by their doctors, and so these are easy ways that they have found that they can help their children and not have to need that physical contact with another individual. I think they can more control it themselves in that way. So that's how it's used with children.
Okay, thank you, Cameron. California has a new requirement for physicians to prescribe what they describe as powerful mind-altering medication, and this graph is a representation of that. For a child under the age of 18 to be prescribed one of these medications, a board of state-appointed pharmacists must approve the rationale of the prescription as well as the child's well-being. Within 4 months of this taking effect, there was a decrease in how often physicians were prescribing antipsychotic medications. Okay.
So based on this study and graph, antipsychotic medications were previously overprescribed. Based on the Professional and Ethical Compliance Code for Behavior Analysis, the use of chemical restraints is unethical. Code 2.09a states that treatments or procedures used are effective based on empirical research and state that it is the client's right to receive effective treatment. There is not enough empirical evidence found to support the use of chemical restraints. Therefore, it is unethical to administer chemical restraints.
In general, the use of chemical restraints are important for individuals who may become a danger to themselves or other people. So therefore, it is ethical to be administering these so that they are not harming themselves or other people. Sometimes the use of a chemical restraint is needed. For that reason, guides have been created in order to make sure that psychiatrists who administer these medications are doing so minimally, appropriately, safely, and that they're respecting the rights of the patients. Tasmania's Department of Health and Human Services created a chief forensic guide to assist in properly administering medications as chemical restraints. This states that the use of chemical restraints are the most restrictive and they should only be used when directed by the psychiatrists. The reasons for administering a chemical restraint are to facilitate a patient's treatment, prevent the patient from harming themselves or others, or to transport the patient from one facility to another. So the use of a chemical restraint is ethical and necessary for individuals who are a danger to themselves or others.
Going on the ethical side of physical restraint, another form of ethical restraints that is used in schools is physical. The purpose or definition of physical restraints is to control the behavior of the student in an emergency situation to prevent immediate danger or possible injuries to the students or others in the environment. In 1997, amendments were made in the Individuals with Disabilities Educational Act, IDEA, to assure that schools provide a safe learning environment and staff be properly trained in crisis prevention and restraint procedures. Adding restraints may only be used as a last resort to prevent injury to self or others. If procedures are implemented accurately and safely, it can protect the individual from harming themselves and others. Federal policies state that every agency and school has implemented professional training for staff. If all other possibilities have been exhausted when assisting an individual with extreme cases of physical aggression, physical restraints are legitimately the only intervention that can be used. In the Professional and Ethical Code for Behavior Analysts, Code 4.10, states that a behavior analyst should minimize their use of reinforcers that could potentially be harmful to a client's development, health, or that could be considered unwarranted motivational operations to be efficient in the behavior change. There is no evidence of any side effects of psychological damage in the individual who have been physically restrained. Physical restraints can be used as a therapeutic hold, which could decrease aggressive behavior safely and assist with children uh, and to assist children with articulating and acting out emotional feelings. And next we go to physical restraints, which are unethical.
Okay. I want to make sure you all can hear me. There we go. Perfect. Okay, so restraints are not always used as a last resort. The Council for Children with Behavioral Disorders determined that the use of physical restraints within schools have not been proven to be implemented for any other reasons other than to control the students and to gain compliance. There's no evidence stating that this procedure is best practice. Most educational textbooks and literature state that the use of physical restraints on children that engage in aggressive and violent behaviors are implemented mainly for the use of safety, even though there's a lack of empirical evidence supporting its effectiveness. There is minimal research on the use of physical restraints in the school setting. Due to this, it's undetermined how many schools use physical restraints and if it has any outcomes that benefit children. Currently, there is no national regulation that is being enforced pertaining to reporting or the use of physical restraints. With this lack of evidence, the procedure of physical restraint should not be used as an intervention at all. If they are not being studied and regulated, the end result is the misuse of the procedure, and this only leads to injury of the individuals being restrained.
Back to the ethical for physical restraints. According to an article titled "My State Seclusion and Restraint Laws" by Jessica Butler, which was published in 2013, there are actually a couple of states that require data collection. The data collected basically provides important clarity that allows public oversight and enables schools to analyze data, respond, make changes. And per Butler's research, there's actually 28 states that require data. For example, California and Texas reported 33,000 incidents in 2007 and 8. In 2010, Florida started collecting data. Florida actually gave a report of 9,751 restraints and 4,245 seclusion episodes in 2011 and 2012. Overall, physical restraint should not and is not an intervention used to control students and their behaviors. This procedure is used after all of the other interventions have been exhausted, and the situation has been determined as a crisis. Failure to act on the part of a parent or caretaker that results in death, serious physical or emotional harm is considered child abuse. An act of failure to act and present imminent risk of serious harm is defined as neglect. Fortunately, we do have a procedure which is physical restraints, and continue education, documentation, and training on physical restraints will keep most students safe.
Okay, so the guidelines are not actually being followed, and the proof of that is individuals are actually being killed because of this intervention. The Child Welfare League of America found that approximately 8 to 10 individuals die each year due to physical restraints. And of those individuals, 1/3 have been reported to be a result of using the restraint technique incorrectly. So things happen such as broken bones, friction burns, joint damage, and they've all been results of physical restraints. With so many injuries being reported, this procedure is not ethical to use. The dignity, safety, and overall well-being of the individual is being compromised. According to the Child Rights Data Collection 2009-2010 school year, 26,766 students with disabilities and 12,026 students without disabilities were physically restrained during the same school year, of which approximately 12% of students with disabilities experienced 69% of physical restraints. It's such a high number. The U.S. Government Accountability Office reports that staff members allege misuse and abuse involving crisis procedures used to control disruptive behaviors instead of those of immediate danger that can cause serious physical harm to themselves or others. The seventh core principle outline in the Restraint and Seclusion resource document states, to ensure students are protected from physical harm, all student personnel in educational settings should be well versed in crisis response procedures defined by local, state, and federal policies and guidelines.
Although you made a couple of good points with that, I have a personal example, and basically, if I encountered a situation where physical restraints were implemented incorrectly due to lack of education and training, and this man there, basically, an individual was engaging in violent target behaviors towards peers and staff. The staff members placed the participant in the prone hold, which is basically face down, and due to that event, he lost oxygen and passed away. Although this incident did occur, that does not lean more towards the restraints not being ethical. It just leads back to the education and training procedures of the participants or staff members engaging in it.
One question that Dr. Derringer had for us is how can we make sure that restraints are done correctly?
The proper way to do restraints is going to take a lot of training, supervision, and monitoring. Just like any procedure that we engage in, it takes practice, and at facilities in Kentucky, they do a monthly and sometimes a weekly training on restraints. It's important that the staff members are trained to the point where they're comfortable presenting these skills in crisis situations.
Okay, thank you, John. Next, we will be talking about mechanical restraints, which is Carrie will present the ethical part of it, and these are just some examples of the different type of mechanical restraints that she will be talking about.
There we go. Okay. So I'm going to talk about the ethical side of mechanical restraints. Another form of restraint used in schools are mechanical restraints. Mechanical restraints are known as any type of equipment, including tapes, ropes, weighted blankets, and/or repression, subduing someone by force. All of these mechanical restraints violate an individual's right of freedom of movement. As a behavior analysis working in an educational setting, we have the responsibility to ensure that mechanical devices used inside the classroom do not violate the following core ethical principles, such as respect and autonomy, that may violate the independence or self-sufficiency of the student, do no harm by stepping outside of their area of expertise to collaborate with other professionals, such as physical therapists or occupational therapists, to seek out means for which students can physically participate in classroom activities, and according dignity, to ensure students may be given the opportunity to make choices throughout their day. Mechanical devices that are being used inside the classroom are weighted blankets, standing tables, and standing chairs. Those are the ones that you saw in the picture. Standing tables and standing chairs use restraints to provide mechanical support for students whose muscles and bones are too weak to support their own body weight, such as in students with cerebral palsy or any other student that may have an orthopedic need. These types of mechanical restraints help support students from falling and injuring themselves even more. The use of standing tables and standing chairs with restraints fulfills the core ethical principle of respecting autonomy, providing students a greater opportunity to learn and participate in educational activities. As written in the core ethical principle, according dignity, behavior analysis have the responsibility to ensure every student with ASD be treated with dignity and respect. Weighted blankets are another form of mechanical restraints used by occupational therapists and physical therapists in educational settings, with the intent to calm students with ASD down, to reduce anxiety and hyperactivity. The proposed use of mechanical tables, mechanical chairs, and weighted blankets are used so that students are given the opportunity to increase their learning capabilities and participate in educational activities.
And in the rebuttal to Carrie's statement, she talked about how mechanical restraints such as standing chairs and tables and wheelchairs and other things can be used as a restraint in order to help increase independence and as therapeutic means. I think the main issue with those is that, yes, they can be used inside the classroom ethically, but what happens when they're used unethically? For example, I've seen that a standing table to be used to prevent a child's range of motion instead of it being used for a therapeutic intervention strategy. So what happens when we are using restraints as limiting their ability to move around a classroom, or when a situation happens and maybe two individuals have an altercation with one another and one of the individuals are in a wheelchair and we put them inside of their wheelchair and put them into another room, that's a form of restraint and that's seclusion. So yes, those restraints can be used ethically, but they can also be used unethically. According to the Civil Rights Data Collection, in 2010, like Carrie said, mechanical restraints are defined as any type of device or equipment to restrict a student's freedom of movement, and they should never be used in an education setting unless prescribed and administered by a licensed physician or other qualified professional. So the problem with that is that we have mechanical restraints being used inside of a school, and we're allowing the teachers and other individuals to use it who aren't licensed physical therapists, physicians, or physical therapists. So, and other examples of this are like medically approved and service-related mechanical restraints, vehicle safety restraints such as seat belts or vests, restraints for medical immobilization, like I mentioned earlier, wheelchairs, or orthopedically prescribed devices such as neck, leg, or foot braces, and other adaptive devices like Carrie mentioned, standing tables or chairs, and even weighted, and she also mentioned weighted blankets. Those as well can be used as a restraint. What happens when we're using a weighted blanket to keep somebody still and to prevent them from moving for reasons that aren't therapeutic?
So in conclusion for mechanical restraints, according to the National Autism Center, Evidence-Based Practice in Autism in the Schools, 2nd edition, 2015, these type of restraints fall under sensory intervention package and are considered unestablished interventions due to their lack of evidence in scientific literature. Nevertheless, these types of mechanical restraints are being used in educational settings, and their uses should be closely monitored and supervised. Mechanical restraints should only be used under the written order of a licensed physician, occupational therapist, and/or physical therapist. And they should also be included in the student's individual education plan, along with written consent from the parents.
As far as mechanical restraints being unethical, there was not much data on there that when we researched, because period point blank it was kind of stated that mechanical restraints should not be used inside of the school setting. Next, Lana is going to present some of her experience with physical restraints, and she'll share those with you guys.
Okay, so restraints as a whole. At my agency that I work at, I have actually been with the population of with intellectual and developmental disabilities for 5 years now. And our agency's policy within the regulations of the state forbid us to use any kind of restraints at all. In Kentucky, the Department of Behavioral Health, Developmental, and Intellectual Disabilities monitor these regulations. We have to stay in the compliance of these regulations in order for Medicaid to continue to fund the services that we provide. Since working with this population, I have never, ever had to physically, mechanically, or chemically restrain any individual that I've worked with. Instead, we have been taught other proactive strategies, such as blocking with pads, using soft things such as pillows, clearing an unsafe environment. What has been embedded into my brain over the past 5 years in my job is that by me placing my hands on another individual, the only outcome is going to be that I'm going to hurt that person even more, or they're going to end up hurting me. And so in all my years, this strategy has worked, and I've never experienced an individual's aggression that couldn't be de-escalated, which leads to the conclusion that restraints are unnecessary.
However, on the other side of that, I myself, I work for a state agency as well, and I have the exact opposite experience. We have, I work for a state agency in Missouri, and I've worked with clients who are like on different sides and scales of their aggression. So have I used restraints? I've seen chemical restraints issued. I've seen mechanical restraints done, and I've been part of plenty of physical restraints. And each time that I can honestly say that any time that I've conducted a physical restraint, I felt that it was absolutely appropriate and it was deemed necessary at that moment. Do I advise that physical restraints be the first thing that we jump to? No. However, what happens when we are in a situation or in the middle of Walmart and we have a client who's breaking things and trying to hit other not only clients but other people in the community? At what point do we say this is a safety risk for themselves and the surrounding people in the area? And sometimes the physical restraint is your best option in that moment. So yes, sometimes we do have to jump to a physical restraint, but we also have to hit other things first. We use strategies such as tools for change, which focuses on de-escalating situations and building relationships with clients. So when you do get to the hot situations, what we like to call them, you don't have to jump to a physical restraint and do that. However, sometimes we do still get to that point, and sometimes they are absolutely necessary in that moment.
Just kind of an extension on what Tamara has said about, when there are situations, or situations do occur when physical restraints or restraints in general are necessary. So the Council for Exceptional Children and the U.S. Department of Education state that every educator should become familiar with their local, state, and federal policies and guidelines on crisis procedures used in an educational setting. Educators should also have a clear understanding of how schools and districts operationally define what a crisis situation looks like, so that all school personnel and anyone else working with the students, including BCBAs and paraprofessionals, they will be able to identify a crisis situation when it occurs.
So, in conclusion, I think that we can all agree that restraints overall should be used only as a last resort option, and after all least restrictive strategies and procedures have been tried, all restraints, including chemical, mechanical, and physical, have the good and bad, the pros and the consequences. However, whenever a restraint is done, we as a professional needs to take a step to take a procedure review of the restraint situation, and it helps to determine whether or not the restraint was used appropriately. You know, questions that should be asked is, what steps did you guys take in order to de-escalate this situation before we got to a restraint? What less restrictive procedures were used first? Was the restraint done according to your facility's rules and protocol? Or was there anything that could have been done differently to prevent the restraint? Or, you know, hindsight is 20/20, so looking back and for future references as well, is there something that we can do differently to prevent the restraint from happening in the same situation? So what this does is to help minimize all restraints in general, and I think that this procedure of having a restraint review will really help that out. Thank you, guys.